All right. Well, good morning, everyone. It's an awesome Monday morning here at Healthline Markets. It is 9:03 on May 8th. Thank you all for being here live in person to improve and to be a part of our mission, improving the lives of our community with affordable health care. So thank you guys for being here and thank you for being a part of that mission. We are back at it. It's still locking here. We're in Q2 of the year, and we are moving and grooving. And as normal, we always want to keep one foot in the classroom and the other one in the field at all times. So let's go ahead and take a look at the training calendar this morning. There's a bit of training coming up that is super important, and then also some ideas on how to step up your game. Okay. So as always, at 8:30, there's a training link to our Medicare Shop 2023 training for those of you that are interested in learning about our all-in-one quote and enroll tool that allows you to do an application from anywhere in the world as long as you have an internet connection and a laptop, right? And this now is expanding even further. We're adding new products like Health First is coming online for those of you that are in the Brevard market and some other ones across the country. This is one of the largest enrollment platforms across the country, and we have branded our version as Medicare Shop. So you can send an email, a text message, or even do a full enrollment using just your phone and this enrollment software system, and it's fully compliant. And we need you guys to really pay attention to this because this is the future. If you're not already using this software, shame, I know your name. We really want to get you up to speed on this because with the changes that Medicare is going to be making for 2024, especially with marketing, I really don't understand how else you're going to be doing enrollments. So please learn the software. It's not only the future, it is something that is just inevitable. Okay. In fact, one carrier a couple of weeks ago has announced that they will no longer be printing paper and physical enrollment kits. Let me repeat that. There is a carrier, I'm going to mention in a minute here, that has announced that they will no longer be printing physical enrollment kits, which means that all of their assets will be available online only in digital format. We do understand that some folks are going to still need some of those kits, but it's going to be by order only. It's not going to be available in the market. And that carrier is Devoted Healthcare. No surprise there. They're one of the bleeding edge technology companies that has got the A-OK from Medicare to say, hey, we're not going to print $2 million worth of paper next year, saving you, Mr. Government, tons of money. So I anticipate that there are going to be more and more carriers that are going to say, hey, why are we printing kits when everything's on Medicare Shop, like Justin said? Okay, so get online and make sure that you're learning the software. Okay, if you need one-on-one coaching, if you need help with this, please let us know. Just shoot an email over to support@askhpm.com, and we'll sync you and link you with one of the team members here that can help you with that. Okay. All right, so later today, you've got United Healthcare virtual office sessions. That's happening still. So if you have any questions, comments, or rude remarks for United Healthcare, that's available for 4 o'clock today. There's also another session on Friday from 3 to 5. So kind of a happy hour for United Healthcare, if you will. If you have any questions or concerns, you can reach out to them again today at 4 o'clock or on Friday the 12th at 3 o'clock. Over tomorrow on the 9th, you've got Medicaid redetermination training. Jump in there and we can help you understand more of what's happening with Medicaid. If you've missed all of that, please look through our YouTube channel. We've got tons and tons of comments and videos on what's happening and why for Medicaid redetermination. Why should you care? Because if you have any D-SNP membership, if you have anybody that's on a Medicare Medicaid plan, this is going to impact your members. Okay. And if you're not paying attention, they're already starting to get letters from the state. And so if you don't get in front of this, what's going to end up happening is your members are going to lose Medicaid. They're going to get disenrolled from their D-SNP plan, and they're going to get enrolled with somebody else that does care about them. Okay. So pay attention and make sure that you know what's going on with Medicaid. All right. Moving on to the 10th, Wednesday, we've got a coffee and chat session with the one and only Al Clancy. He's going to be available at 9:30 on Wednesday, this Wednesday. Again, guys, this is the master of disaster here. This is the guy that you really want to sit down with and figure out, hey, how can I improve? How can I blow up my business? How can I really take it to the next level? And Al has a very keen talent of really kind of figuring out where you're at, what resources you have available that you might not even know about, and taking your business to the next level. So please spend some time with Al. I think that this is a fantastic opportunity for our folks to really see a fantastic mentor in action. Even if you're a veteran and you're like, look, I think I'm doing just fine, you never know. Al's given me lots of great ideas and some coaching advice, and even me, a fly on the wall in a lot of these sessions that he used to do at United. I got a lot of value from. So again, that's 9:30 on Wednesday. It's a virtual session. You can jump in there and he'll take care of you there. All right. Wednesday, there's a lot of Humana training going on. You've got one at 12 o'clock. How to find new clients. That one seems important, right? If you're struggling with lead generation, spend an hour with Humana, maybe you get some ideas. Also at 1 o'clock, Humana is doing the mail order pharmacy. So if you're learning about how that can impact your business, or you might get an idea for marketing on that, that is at 1 o'clock on Wednesday. And at 2 o'clock on Wednesday, Humana is doing another training for retention strategies. Okay. So this is what we call the leaky bucket syndrome, right? You got a lot of agents out there. Maybe you're guilty of it, where you're really good at lead generation, right? You've got a lot of traffic. You're getting people calling you, and they're all falling out of the back. Okay. You got to have a retention strategy too. Okay. You can be really good at retention, but if you're not finding new clients, you're not growing your business. So this is a 1-2 punch from the training sessions here on Wednesday. So this is a good one. Retention strategies are really, really important. In fact, I'm going to show you one of the retention strategies today that you can use and implement today, right after this call today. You can implement to what I like to call build a fence around your chickens. Okay. If you're not building a fence around your clients, if you're not building that mental fence around your clients, then they're going to wander off. They're going to find somebody else to work with. Okay, so we're going to talk about that too. Okay, that's Wednesday at 2 o'clock, retention strategies. Jump on that training if you feel it's going to be a good fit for you. Also on Wednesday, Cigna is doing a virtual office training. Again, kind of like that United Healthcare happy hour, but for Cigna Medicare, that's going to be on Wednesday at 12:30. So if you have questions or you're working a little bit more with Cigna than you used to, it might be a good idea to pop in there for a session there. And then we got Thursday at 11. CenterWell's doing an insulin savings training. This could be really good for lock-in. Why? Because if you understand how the insulin savings program works, if you understand how it correlates to your primary care doctors, if you understand how the insulin savings program helps seniors and also helps those folks that might be coming into Medicare for the first time, this could be a really good thing for you to know. Now, how does that translate to sales, Justin? Well, who needs insulin savings? It's people that are diabetic, right? And there are health plans out there that are called C-SNPs, or chronic condition plans, special needs plans. And those chronic condition plans are specifically designed for people that have diabetes. So if you're out there and you're promoting that, hey, I can help people with an insulin saving program, you're going to attract diabetics. You're going to attract people that says, hey, I'm interested in learning how you can help me save it on insulin savings. Okay. And there's tons of marketing materials across some of these carriers that you can access to promote, whether by mail or Facebook or whatever you're doing, tabletop events. And you want something out there that says, I can help you with your insulin savings, because you're going to attract diabetics. Diabetic comes to you and says, hey, I'm interested. Boom, you have a candidate for a C-SNP enrollment, which means that you can do an enrollment today and get paid tomorrow, because CSNPs can enroll year-round, right? So that's an opportunity for year-round enrollments. So, we put up these trainings, guys, not to torture you. It's because we find value in these, and we find that there's an opportunity for you to expand your business. Okay. So if you're promoting, hey, I can help you with insulin savings, I can help you. You just attracted somebody that can enroll in a CSNP plan. And there's more CSNP plans than there ever has been before, because the carriers realize that this is a massive opportunity to continue to grow and move forward with their business by attracting those folks that need, a little bit more TLC. Okay. So insulin savings program, 2:00 on Thursday. And that's it for the training for the week. Remember, guys, one foot in the classroom and the other one in the field at all times. Take a second here. There's a question from Mark. Mark, can you mention all the major plans that accept the FEMA SEP? Humana goes to 731, but not sure with the other ones. That's a great question, Mark. And I'm going to shoot you guys over to our Gold Key. And in case you forgot where that is, you can go to Join HPM. Let me see if I got this right. JoinHPM.com, Gold Key, or it might be AskHPM.com, Gold Key. Let's see if this one works. Yes, JoinHPM.com/Gold Key. I'm going to put that in here in the chat. If I can spell it right. And there's a link. You can click that. It's a shortcut. And in here, guys, you're going to see on the right-hand side under Activities. Let me turn on my mouse here so you guys can see that a little bit better. When you go to joinhpm.com/goldkey, on the right-hand side under Activities, you're going to see special or check available SEPs. So I'm asking the team to keep this up to date as much as possible. So when you click SEPs, on the top here it says hurricane and disaster SEPs available. There are other SEPs across the country that are available to access at any time here, and we're collecting those, or at least we have a link. So for example, WellCare keeps their own SEP list pretty fresh. So if you click that, it'll take you directly to WellCare's Broker Resource Center for special election periods, and it goes by state. So let's say you're doing business in, I don't know, California. You could see that there's an ongoing SEP for inclement weather and flooding. So you can actually click this one, and it will open up some more details about that specific SEP. What counties are affected, what was the incident date, what is the time frame, when does it expire, has it been renewed? A lot of those questions are available right there in the SEP. So take a little bit of time and find that. So if you click down to Humana, Humana's got a bunch of different links there and some extra help. But if you go back there, this specific hurricane and disaster SEP, we've got lots of different links to help you out there. So we ask John to keep that up to date for us and make sure that we've got that information. If you can't find what you're looking for, remember that you can always go back to support@askhpm.com. We're available there Monday through Friday, 9 to 6. So we can help you as much as we can, or you can call us at 844-696-3975. Okay, so this is where you'll find all the detailed information about other SEPs available, including the hurricane SEP from Humana, which now extends to July 31st. Another key point I just want to mention on this too, and thank you, Mark, for bringing this up, is these are being sent to you by email. Okay, if you're not reading your emails, you are going to miss out on a lot of important information. Okay, so please check to ensure that A, you're getting the emails, and B, that you're checking the emails quite frequently. I'm not the best email checker, but I spend about an hour in my email every day. I just set it aside, I put it on my calendar, and I check my email once a day for an hour at minimum. Sometimes I'm in there a little bit longer because I've got projects that I'm working on. But set aside time every day, check your emails, read the emails, understand the emails, and if you don't understand those emails, please send us a note, and we're glad to help you out. We're glad to help you understand what's going on in those. So thank you, Mark, for bringing that up. It's a great point, and we appreciate you paying attention to what's going on to those SEPs for Humana. Okay, for the rest of the time, today, I want to talk about what we were talking about earlier as far as retention is concerned. And I'm sharing with you a situation that happened to me with one of my members. Now, I don't sell anymore. Um, in fact, I know a lot of you have received referrals that came through me because I just don't uh, sell anymore. So, but what I do is I service the members that are continually on my book of business. Okay, they just for whatever reason haven't left. And so I felt for a long time that I was doing them a disservice because as we were building HPM, I became more in the management and administration roles as an executive here. And unfortunately, I wasn't able to spend a lot of time or TLC that members deserve, right? So enter Spark, right? This is one of the main things that I thought of that I saw immediate value for myself. And so I figured that translates to you as well. So if you haven't already signed up for the Spark platform, please do. But today I'm going to talk about the Spark platform in general and a case study that I'd like to share with you personally with one of my members. So my member's name is Pearly Sewell. I met her back in, I think, 2011. So this is going back quite a bit. And I was working at a carrier. She responded to one of my brochures that I sent out. I went to her home. In fact, she had a roommate there, and I ended up enrolling her in another plan later down the road. But Miss Pearly's been a member of mine for a long, 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 long time. At one point, I gave her to another agent. The agent failed to service her, so she called me back, and I, said, "Hey, I'll take care of you." So this last AEP, she called me because she got one of my Spark postcards that gets automatically sent out. Yes, automatically sent out to the entire book of business, just checking in. And I did have to change her back into a different plan. So in this case, Aetna was the best choice for her coming up for AEP, and we got her enrolled in Aetna. Now, we got her enrolled, and she part of the presentation was talking about these flex cards that are very, very hot right now. And so she called me and she says, "Hey, I don't think I got my flex card, and I didn't get my ID card yet." I said, "Oh, that's kind of strange." So here's the interaction that I wanted to share with you because this is exactly what happened. I hung up the phone with Miss Pearly and I said, "Hey, you know what, Miss Pearly?" Before I hung up, I said, "Miss Pearly, I'm going to have my team reach out to you. My team's name is Spark, and they're going to call you and they're going to walk you through on how to get this stuff for you. Okay?" She said, "Yeah, that's great. Go ahead and have them give me a call." So hung up the phone, opened up the link on my phone. I was in the car driving, so I pulled over and I did a talk to text. I found her in the Spark platform. I opened up a ticket, which I'm going to show you guys how to do that in a minute. I did talk to text, and I'm going to share with you exactly what I put in that talk to text. So the talk to text, I said, "Pearly needs help getting her flex card from Aetna. She received her enrollment package, but did not have the credit card included. Could you please reach out to Pearly to help her get the flex card so she can start using it right away? Thank you." That was what I said. It translated it to talk to text. And then I was satisfied with that. I was a little bit in a hurry, so I misspelled her name, unfortunately, on the second part. And I hit send, and off I go. And the next day, Juleska gave her a call, and you can see it here on the screen. Outbound call to member's home, no answer. Unable to leave voicemail, mailbox is full. So she left that note. And when she left that note, I got a text message. And the text message said, "Hey, there's been an update to the ticket." So I wanted to see what was going on. So, I turned it on. You can turn on and off the notifications, which I'll show you here in just a minute. But I went in there and I saw that, oh, she hasn't reached Pearly yet. So I said, okay, let me give it some time. So then actually the same day, about 45 minutes later, Juleska tried again. This time, outbound called the member's cell phone. We did a conference call to Aetna, spoke with Andrea. She placed us on hold to get in contact with the vendor Nations. She stated benefits card was mailed out and members home, I guess 2 members home, and would be received today or tomorrow. Both benefits would be loaded on the card. OTC, $240, and an extra benefits of $480. Now, if you know about Aetna and their D-SNP product, it's absolutely incredible across all markets, really. But specifically, she's in Florida, but they have a phenomenal benefit for the Flex cards. But anyway, Andrea also ordered the member a new ID card, a provider directory, a dental directory, an evidence of coverage, a drug formulary, and an OTC catalog. This was all done on my behalf from the team at Spark. Okay. Then Juleska left me a note, and she says, "Hi, Justin. I assisted the member in getting her Flex card as well as ordered a few items she wanted." So apparently that conversation with the team at Spark had evolved into asking for other things. And so, looking at that interaction, she didn't tell me the whole story. She was just really concerned about the member ID card. And then Juleska pulled some more information out of Pearly and found that she actually was looking for a little bit more. Okay. So if she hadn't done that, she'd probably call me back too, maybe 3 more times, asking for different things, right? And that's pretty much the end of the interaction. I could tell you that particular interaction, there was 2 phone calls made. They did a three-way with Aetna. They were placed on hold. I would anticipate that particular interaction would have cost me about 45 minutes to an hour. And remember, the only thing I had to do was plug in the ticket. And then I get a notification that the ticket's been closed, and I can read about the ticket, and it was a successful interaction for Miss Pearly. So after that happened, I went ahead and called Pearly back, and I said, "Hey, Miss Pearly, how'd it go?" She said, "Fantastic. Thank you so much. My ID card, they said it will be here the next day." I said, "Give me a call if you don't get your card in the next day or so." So I haven't received a phone call, so I assume that she got her card. But I called her back and I asked her how to go. Was there anything else she can help with? And oh, by the way, if you know anybody else that might need my help with Medicare, please remember that I'm here to help. No, she said, "In fact, my neighbor just moved here from Massachusetts and I need you to talk to her." Guys, this is the kind of stuff that drives client referrals. This is interaction. Most of you have this thought of, "Oh, well, how do I get client referrals? I'll just sit by the phone and hope that my members remember me and hope that they send me business." Hope is not a strategy. Hope is not a strategy. So what are some things that you can do to drive client referrals? This is it. This is exactly what you need to do to drive client referrals. Client referrals are the #1 lead source across all marketing efforts at Healthline Markets, and is probably the #1 lead source across this entire industry if done well. Okay? So all of this is available to you as well. Okay, so I'm going to show you a quick live example on how to do a ticket. Oh, and by the way, they also, Juleska also sent me a copy of the summary of benefits for her specific card, and it lives in her portal now on Spark. So anytime I need to access benefits, I don't have to jump around. It's right there for me. She left a link to the PDF. So I've got her full benefits. I can review it with her at any point in time. Now keep in mind, Juleska is not licensed. She cannot discuss benefits. So any benefit question that she was asked by Ms. Pearly, she referred her back to me. So that's kind of how that works there. Okay. So there it is. I'm going to share with you exactly how to do this. Okay. So let's go out to, I'm going to demo here. Okay. So in the demo, the first thing that you might want to set up for yourself is you're going to go down to, let me turn on my cursor here for you. It'll work. Maybe not. We'll try again. All right, there it goes. So on the bottom left corner here, you're going to see my account. And the first thing that you want to do is just take a look at what kind of communication preferences do you have? Okay, do you want to receive text messages when your tickets are being worked? We're going to open this up. And now you can be notified by email or text message. You can put in your phone number if you're interested in getting text messages. I like that because I'm very on top of my client interactions. I want to make sure that they're being taken care of properly and fast. And I also want to see those tickets. That's a priority for me, right? That's a priority for me. So, just like the entire world, text messages are pretty much answered within 10 minutes, okay? So you can pick what you want to be notified of, okay? If you prefer email, that's fine too. You can just put email. If you want both, that's cool too. Do you want to be notified when the note is made by Spark? Support requests are created. If something needs your attention, definitely. If they're resolved, if new policies are entered, which is by you, if you enter a policy, I don't know why you would want to be notified by that, but you can. If you get a new lead from your permission to contact forms, which we've talked about in the past, you want to be notified by that. That's probably pretty smart, right? You want to call those leads very, very fast. If new leads are assigned via Spark, definitely want to know that. A scope of appointment has been submitted. Remember, you can send scope of appointments through here. A needs assessment is submitted. So that, you sent the member the link and they filled in all their doctors and drugs for you, it created a profile. Probably want to know when that's been done. And then if you have any reminders that are due, all right? All of that is available. You just click save and it'll take you back there. So set up your preferred communications so that way you can stay on top of what's going on. So I'm going to show you very quickly how to open up a support ticket again. The best course of action is probably searching for your member. So you're going to go to the top left corner here, and you're going to type in a member's name. So just in this example, I've got some recent contacts that I've been talking to or have been working with. And let's say, for instance, I'm working with Norma Daniels. So I click Norma Daniels, and I want to open a support ticket. So there's different ways you can do this. I'm just showing you one way that you can open up a support ticket. Okay, so you can see Norma is on the Humana plan. She's in Arizona. I'm going to go up to the right here under this purple button, and I'm going to click the down arrow, and you're going to see add support request. So I'm going to click add support request, and it's just going to verify Norma's the right person. There's the email and phone number. So if you've got updated contact information, you want to ensure that this has been updated. You can go ahead and click edit contact information if you've got the wrong phone number or whatever. This is important because the team if they can't reach the member, they're just going to turn off the ticket, right? They're going to try 3 times and then they're going to close the ticket. So we verified that this is the right email and phone number for Norma. We click yes. What do I need help with? Is it a billing issue? Does she need help finding a provider? Does she need help scheduling an appointment? Does she need help with Part D or any type of extra help? Or is it something else, right? So let's say Norma didn't get her ID card, right? So that would probably fall under other support. We click that. We want to make sure that it's related to her honor policy and not something else. If you do have the member ID number, go ahead and punch it in there. If it already exists, it'll show there. This is an opportunity for you to collect more data. This is really important, right? And you're going to click continue, and then this is exactly what I did. Now, you can do this from your phone, guys. You can do this from your phone. Just save the link on your home screen, and it'll kind of turn it into an app feature, right? So just type in, in this example, Norma hasn't received her ID card. There it is. And then what is it that you want them to do? Please call Norma and help her get her card. There it is. And as soon as I click save, it's going to open up a ticket here. Now, if there's a picture that you need to attach, you can do that. This is specifically helpful for, let's say, a member sends you a bill or something like that. You can do that and then click save. And there it is. I opened up a ticket. You can see that it's open. You're going to verify, that the member has, not any do not email, do not call links. That is something that you can set up individually for each member. So if your member says, hey, look, I don't want to be called, I just want to be emailed, or vice versa, don't email me, just call me, or just text me, don't call me. You can set up those contact preferences for each of your members to do that as well, and the team will respect that, which is really important. Let's say Norma calls you back and says, hey, I got the ID card already. I just got it. Then you can go ahead and delete that support request there or leave a comment. She still hasn't received it, whatever the case might be. But that's it. That's one way you can do that. I just showed you how to get to that support. The other way is from the home screen. If you click support, you can click the big purple button there, add support request. The only difference there is asking who are you helping, and you can search by first or last name. And there's Norma Daniels again. So just a couple of different ways that you can get in there to start a support request. Okay, guys, this is a lifesaver. I mean, if you're not using this feature and you've got a book of business, and especially a significant book of business, I mean, I kind of feel for you. I don't know how you're surviving. This is awesome, right? Okay, a couple of questions here in the chat. Mark asks, when Spark calls a plan, the plan takes their call even though they aren't the agent of record. Yes, the reason they're able to do that is because they're doing a three-way call with the member to member services or customer services at the health plan. Anyone can be on that call with your member. Anyone. Okay, they don't have to be the agent of record. Now, when they get on that phone call, they're going to ask, hey, Norma, it seems that you have Juleska on the line with you. Is it okay that I continue? The answer is yes, you can continue, right? This happens quite frequently, whether you know it or not. For instance, if your member tells their daughter to call with them to the health plan, they're going to always and forever say, there's somebody else on the line. I got to get your permission that I can talk to your daughter. Is it okay for me to continue? This happens quite frequently across the industry and in other industries, in fact, as well. So an agent or AOR is not necessary for you to do a three-way call to member services with your member on the line. Okay, so that's how they're able to kind of skirt that issue. Elise asks, also, was this call required to be recorded? Now, Spark does that automatically for all calls, so you don't have to worry about that. And they keep the call recording in case there's ever an issue. So that's already being done. Great question. But if you, the agent, are calling, just remember the rules. Call recording is still required. You got to have some type of system in that. We'll talk about that on another call. And the last question I have here is, can Spark also help a member apply for LIS or Medicaid? At this time, no. However, they can send links to how to apply and where to apply for the member. So if you're a member, if you just can't deal with it for whatever reason, you can send them, to Spark. Spark will call the member and say, hey, here's where you're going to apply for Medicaid through the state. This is some resources that I found. They're also going to punch that into the ticket as well. However, as I had told you before, as an agent, I highly recommend that you learn how to help people apply for Medicaid and LIS. Very simple. I'll cover that on the next call. But also, just so you know, at Health Plan Markets, we can help your members apply for LIS and Medicaid. Okay, we can do that. All you need to do is send us an email at support@askhpm.com. We have some team members that are savvy with helping your members apply for LIS and Medicaid, and we're here to help you protect your book of business. And those folks at Health Plan Markets are not licensed either. They are there to simply help you apply for LIS or Medicaid. So great question. Spark does not do that, but Health Plan Markets does. You just send it over to support@askhpm.com and we can get that done. Elisa says that could be helpful with redetermination, right? Yes, so that's exactly what we can help do. I can tell you that your members are going to need to apply or reapply. I know that we can handle the volume at this point because we haven't had a lot of requests for Medicaid redetermination or Medicaid reapplication. Many members are handling it on their own. But again, guys, this is a great opportunity for you to reach out to your D-SNP members, ensure that they know what's going on, and help them, okay? You want to differentiate yourself from the agent next door. If you're going to do the 1% that other agents are not, you're going to be in the 1% that agents can't be in. So one of the reasons I was successful was because of the D-SNP population, and I was willing to go and help the D-SNP population. Even though I didn't get paid a lot of the times, I got tons and tons and tons of referrals because they would say, call Justin, he'll help you get Medicaid, food stamps, cash assistance. Just call him, he'll help you. And I did. And then I discovered that they had Medicare, and I said, hey, I can help you with that too. So that's how I did it, guys. That's the secret. That's the secret sauce. Can you put a link in the chat for Medicaid and LIS application? I will show you where to go. It's going to vary per state, okay? But the LIS application is at ssa.gov, I think it is, .gov. And this is the Social Security Administration, okay? And under Medicare, apply for Part D extra help. There it is. Okay, so ssa.gov for LIS. For Medicaid, it's going to vary by state. Okay, so for the state of Florida, it's myflorida.com/access Florida. Again, it's going to vary per state. I think I spelled it wrong. Yeah, myflorida.com/access Florida. So that's the one I typed it in wrong, but you're going to go there and you can apply for Medicaid that way. It's going to be different for Georgia, New Jersey, Texas, Alabama. Medicaid is by state. The LIS link that I just showed you at ssa.gov is the link for the entire nation. It's the same wherever you go. So hopefully that helps. Okay, guys, that's all I've got for this week. I really appreciate everyone tuning in. I hope this information has been helpful. As always, if you have a suggestion or if you have an idea or if you want something covered on the next call, just shoot me over an email at support@askhpm.com and we'll take a look at that and load it into the next call so we can give you some help. All right, until next time. Thank you, guys. We'll see you on Monday. Have a fantastic week. I hope this helps. And do what you do best, helping our